Good morning, Ms. Rupert. Tell me about your patient that you're going to take care of today.
Hi, Professor. Well, I have a 73-year-old patient who has acute cholecystitis, and she's in the hospital.
Well, tell me a little bit more. What is acute cholecystitis?
Well, it has to do with the gallbladder, and the gallbladder is inflamed.
Okay. So what would you expect to see with that? What's her biggest problem?
Well, she has a lot of pain. She has abdominal pain, and so she's probably going to have her gallbladder removed.
Okay. Have they done any testing on her?
Well, let me check. It seems to me like they did a scan yesterday.
Okay. All right. And it showed the cholecystitis?
Yes, it showed inflammation.
Okay. So what labs would also tell you that she might have some inflammation going on?
Well, she has, her red blood count is a little low. Normal is 3.9 to 5, and she's 3.8. Specific to the gallbladder, I don't really see anything on here that's specific to the gallbladder. Her albumin, which I know has to do with the liver, is a little low. It's 2.7, and normal is 3.6 to 5.
So you don't see anything on there. What might you see in any kind of inflammatory process?
Probably a high white count.
Okay. Does she have a high white count?
Oh yeah, she does. It's 13, and normal it says is 3.8 to 9.8.
Okay. What are your first cells that go in there in inflammation?
Neutrophils?
And how's her neutrophil level?
Oh, her neutrophils are 10.6, and it says here that the neutrophil absolute is 1.8 to 6.6, so that's elevated.
So you think that has to do with her inflammation?
Could be, yeah, because if her neutrophils are high, then that would make her white blood count high, wouldn't it? Okay.
Any other labs that are abnormal with her?
Yeah, well, like I said, her red blood count is low, her hemoglobin, hematocrit are both low.
And that is from what, do you think?
She's anemic. She probably has
is, but why?
an iron deficiency, probably, from her food. She's probably not eating well.
All right, that's a possibility. Do you have any iron studies on her?
No, there's nothing here that says that there were iron studies done.
Does infection have anything to play with the red blood cells and the H&H?
It seems like in patho, I remember something about this, but I can't quite remember.
Okay, that's something we might want to look up when you get a few minutes, just to make that connection. There is a connection.
I know.
So
I kind of remember that. Is it because when the body's making white blood cells, it doesn't necessarily make the red blood cells at the same time? It can't do both?
Right, good connection there.
I vaguely remember that from patho.
Yeah, so
I think you taught that class, didn't you?
Yeah. So think about that anytime you have a patient with an infection or an inflammatory process going on. Now, when it's an inflammatory process, does that always mean infection?
No, because if people have had surgery, they're going to have a little bit of inflammation, aren't they, because of just having cut into the tissue?
Yeah, all injury results in inflammation, but not all inflammation results in infection. So good. Any other labs you're concerned with?
Well, I am concerned about her potassium because it's 3.1 and normal is 3.5 to 5, and this lab says 3.3 to 4.9. So her potassium's a little bit low, and I'm kind of concerned about why that's low.
Okay. Is she on any replacement?
What kind of replacement?
Any potassium replacement, medication-wise?
Let's see. No, I don't think so, but I don't think I said anything about her IV fluids. I'm not sure if she has IV fluids that have potassium.
So you're not sure. Does she have an IV?
Yes.
Okay.
Yes.
So when you go in the room, what will you assess about that IV?
Well, I want to make sure that it's patent and that her site is not inflamed, no redness, swelling, or discomfort. But I also want to make sure that the IV fluids are correct, so whatever she has ordered should be hanging. And I'd probably like to see that there's some potassium in the bag.
Good, good.
And if not, maybe I can talk to the nurse,
Yeah, and how would you know that it's the right fluid hanging?
because it would be in the chart,
Good.
what's ordered.
Mhm. Does she have any other comorbid conditions? Anything else going on with her that might affect this?
No, I don't see anything else. It seems like this is the only problem. Oh, wait a minute. I did see that she had a possible urinary tract infection.
Oh, okay. What would you expect to see with that?
She would have possibly some dysuria, frequency, cloudy urine, maybe an odor to the urine.
Okay, good. Is she on any treatment for a possible UTI?
It looks like she's got some antibiotics, but I didn't write down what the antibiotic was.
All right.
But yeah, she was, it says in the chart she's been treated with antibiotics.
How would we verify that she has a UTI?
By the appearance of the urine.
That's suggestive.
Well, we could do a urine culture.
Yeah, did she have one done?
Oh, I think she did. She did, and that's how they decided to treat it, because they had a culture and sensitivity, and it's gram-negative bacilli.
Okay, good. You might want to check what antibiotic she's on. Make sure it's sensitive to gram-negatives.
I will.
So, anything else in her history?
Well, she's got a low protein.
Mm-hmm.
Her albumin is low and her total protein is low. And I think that's probably due to her being NPO.
But how long has she been NPO?
Well, her surgery was yesterday, so
Oh, so she had surgery yesterday.
I think so. Oh, did I not say that? I'm sorry. Yes, she did.
Okay. So, what are you going to do for her? What might you see with her albumin being low?
Well, she's probably got brittle nails, brittle hair.
She might, but do we know if this is long-standing for her?
No, I just thought it was because she was NPO.
Well, let's look a little further into that and consider a couple of things. How old is she?
She's 73.
What's her nutritional status? Do we know anything about that?
No, we don't.
Okay, so we might want to look at that and see what her nutritional status. A couple of days of NPO is not going to make that big of a change in her numbers there.
Oh, okay.
So we might want to look at her overall nutritional status.
So I could ask her about that.
You could.
Is it
maybe
okay if my students are in here cleaning?
might have a dietary consult. Did you think about that? How she's eating at home? Because now she's had surgery.
Yeah, no, I didn't think about that, but that would be a good idea.
So, with the things we've talked about, what's your plan for today?
Well, I'm going to assess her pain. I'm going to offer her pain medications if she needs it, because she's just had surgery. I'm going to ask her about her diet and try to see where she is. She's NPO right now, but it will advance her diet as tolerated and hopefully increase her albumin. Encourage her to drink lots of fluids for her urinary tract infection. Get her up, get her moving, because ambulation is really good for post-op patients to preventing DVTs.
Okay, good. Now, there were a couple of things that you weren't comfortable with. You didn't know for sure. So those are things you want to check on too right away. What were those things?
The diet and what antibiotic she's on.
One more thing.
Can you give me a hint?
Does she have an IV?
Oh, what kind of IV fluid she's on.
Yeah.
Okay.
So those are things you want to check right away and look
Okay.
at that, and then incorporate those into your plan today.
Okay.
Good prep.
Thank you, Professor.